Hi, good day everyone. I am Pia Marvet P. Moreno, a student nurse from Visayas State University. And in today's video, I will talk about protein C and S deficiency. So let's get started.
What is protein C and S deficiency? Protein C and S are two anticoagulation proteins that inactivate coagulation factors 5A and 8A in the coagulation cascade. This means that they act like brakes in coagulation, limiting clot formation and preventing clots from too big. So when either of these proteins is deficient, it leads to a hypercoagulable state, meaning a person is at increased risk of developing clot that could block blood flow. These proteins are produced by the liver and are found in low concentrations in the bloodstream. It is inactive until vitamin K activates it. What are the causes of protein C and S deficiency? There are two types of familial or congenital protein C and S deficiency. Both are inherited in an autosomal dominant manner. The type 1 disease is when there is not enough protein C and S, so there is a quantitative defect. The type 2 disease, however, is a qualitative defect because enough protein C or S are made, but these proteins don't function properly. There are also acquired forms of protein C and S deficiency, like impaired production, as seen in patients with liver disease and patients taking warfarin, also called Coumadin. Another cause is excessive urinary loss, which can be happen in people with nephrotic syndrome. What are the symptoms of protein C and S deficiency? Symptoms of protein C and S deficiency is usually asymptomatic, but symptoms arise when a venous thromboembolism develops. Symptoms of venous thromboembolism includes pain similar to a muscle cramp and swelling in affected leg. If a clot breaks off and travels into lungs, there can be signs of respiratory distress like pain with inhalation, fast heart rate, and fast respiratory rate. A more serious presentation is the neonatal purpura fulminans, which is when a newborn with protein C or S deficiency suffers massive arterial and venous thromboembolism with hemorrhagic skin nephrosis. Finally, with protein C or S deficiency, there can be warfarin-induced skin necrosis, which means tiny thrombi can form in the blood vessels of the skin, causing skin necrosis. What are the risk factors that cause protein C and S deficiency? So these factors include surgery, pregnancy, lack of exercise, age, and accompanying blood clotting disorder. However, the greatest risk factors for the condition are having a parent with the condition or a family history of abnormal blood clots. How is protein C and S deficiency diagnosed? So the first procedure is the blood test. The doctor will take a simple blood draw and then run a test to determine the level of protein C and S. The doctor may perform blood tests because false positive is common. The second one is the assays. It is recommended an initial test for protein C and S, which may be clotting time based or chromogenic. What are the complications of protein C and S deficiency? These include deep vein thrombosis, pulmonary embolism, purpura fulminans, warfarin-induced necrosis, and problems during pregnancy. What are the medications needed to treat protein C and S deficiency? So there are two types of medications needed to treat protein C and S deficiency. The first is heparin and it is injected, and the second one is warfarin, which can be administered orally. What are the treatment modalities used for patients with protein C and S deficiency? This may involve switching of medications such as stopping estrogen therapy and avoiding contraceptives that contain estrogen and progestin. Individuals who have family members with protein C and S deficiency should consider receiving testing even if they have no symptoms. Doctors might suggest long term treatment with blood thinning medications for people who have had blood clots as a result of genetic protein C and S deficiency. What is the prognosis of protein C and S deficiency? So, protein C and S deficiency is not common, but the outlook is positive. Many people with protein C and S deficiency don't have notable side effects. If clotting is an issue, there are many ways to manage and prevent it by doing the following. First, by maintaining a healthy lifestyle. Second, is being proactive about the condition. And lastly, by taking proper medications.
Thank you everyone for watching, and I hope you've learned something about protein C and S deficiency. God bless everyone!